if you are an athlete or you are very near to somebody who is an athlete, whether for fun or professional, um, you know there is a lot of mental challenges to perform better. And this is why sports psychology exists. And if you struggle with mental health problems, also you want to know the difference when to go to a psychologist or a mental health professional and want to go to a sports psychologist. Those are the topics that we are talking today. So stay tuned because this is very informative. I have an expert that is visiting us to explain that. Okay, let's start. Help me please to welcome Edward Dara. Edward Dara is an sports psychology and mental health professional. Very rare to find this combination. You can find about his credentials at the end. I am going to lay all of them out for you. So I want you to enjoy the topic. Just dive into. Let's start. Well, welcome, Edward. Very happy to have you in the show. How are you doing today?
I'm doing well today. Thank you for having me on the show. This is really exciting for me. I've listened to the podcasts many times, and I know my colleagues, we've had supervision in some of your shows and topics have come up. So for me to join today is quite an honor. How are you doing?
Very good. And the honor is ours. Thank you for being here. And how is Pennsylvania today?
You know, Pennsylvania is not ready for a full spring, it feels like. Every time we take a step forward, the next day we take a step back. I'm looking out the window and it's raining again, but we're getting there. I think there's warmer weather ahead, but it's a fun season because all the trees and flowers are in bloom. So there's a lot of hope and excitement about the next few months, especially those that like to go down to the Jersey Shore.
Oh, I envy you. The beautiful scenery on Pennsylvania, yeah? Yeah. So I'm looking forward today because sports psychology has not been a topic in the last 4 or 5 years of the podcast, and it's very needed. Especially, I'm going to ask you a lot of questions about how our athletes can take care of anxiety or depression or whenever they are struggling. So I would like first to know what is, for our audience, what is sports psychology?
That's a great question, and it's an evolving field in the sense that sports psychology has always focused on the performance aspect of sport. So the mental skills, the imagery, goal setting, the parts of kinesiology is connected to sport performance too. So looking at how we can maximize an athlete's potential. We do a lot of research in sports psychology on optimal performance and the zone, also known as flow. So looking at ways to elevate performance in helping athletes reach their potential, stay at that optimal level as long as possible. Sports psychology is an umbrella term, certainly, because when we look at the performance aspect, or more recently, the aspect of sports psychology in the sense of wellness for athletes has become more prominent, especially last year during the Olympic, and most recently at the collegiate level. That has we've seen a lot of mental health related news come out of different prominent colleges, and we'll probably get into that more today. So sports psychology has always been a performance-based practice, but there's been more of a wellness and mental health emphasis more recently that is very connected to performance.
There has been a new wave of sports psychology because I don't know if you see the show. What is the show from Apple? The Ted Lasso.
Oh yes, Ted Lasso. Yes, great show, great show.
Great show, and I love their psychologist. Yeah, it's just so professional and doing an amazing job. So it is more in our mind now. Yeah, thanks to Ted Lasso.
I've actually used Ted Lasso clips because they very much relate to the present day, and to bring just a little bit of comedic side to it and something that everybody knows and can relate to has been helpful for education, not only for the teams that I work with, but even some of the businesses I work with that are looking to elevate performance.
Many years ago, Edward, like 20 years ago, I worked in Mexico with one of the athletes that was ice skating, one of the main athletes in Mexico, preparing her for ice skating competitions. And even though we did a good work, I don't think so. It was my role. Now we have more and we know more about the sports psychologist. So when a therapist should be aware to do a referral to you, when do you think is a good moment? When we need to draw that line?
So it's a great question. So when athletes are experiencing decreased performance or lack of enjoyment, we have athletes that feel burnt out for a number of different reasons in the United States, especially those that are single sport athletes that play all year round at a young age, typically experience higher levels of burnout or injury. So times that you would want to look to refer to a sport performance professional or consultant would be for situations where an athlete is experiencing burnout or situational anxiety related to performance, or if they're looking at ways to increase their level of performance. Maybe they're struggling in high pressured situations. Maybe they're having negative self-talk when they're in the field or playing in games. These are targeted areas that a performance specialist can work on through mental skill intervention and goal setting. Those are specific performance related issues that we see athletes at all levels experience. Athletes will benefit at all levels from intervention from a sport performance consultant or mental skills professional. One thing that I did want to note, and because the lines, you asked a great question about when is it a good time to refer to a sport performance consultant, mental skills, or a certified mental performance consultant, CMPC, which is a prominent credential in the field, is that there's two types of services. There's mental skills and mental health, and some providers may offer both. So in my case, I do specialize in mental health as a licensed professional counselor and someone that is trained in sport performance or mental skills. So depending if you're a parent and you're looking for support for a child, let's say, and your son or daughter is struggling with confidence or performance anxiety, that would be appropriate referral to a mental skills or performance-based coach. If your child is struggling with depression and they're an athlete, or they're struggling with components of their mental health or disordered eating, that's where a licensed mental health provider would be necessary to support your child. There's, distinctions with the clinical and performance part, but sometimes they're hard to differentiate as a parent.
Yeah, you made a very good point. So a sports psychologist doesn't necessarily need to be a licensed mental health professional?
No, yeah, they're typically An individual can have a doctorate in sports psychology, but they're not going to be considered a psychologist
Psychotherapist.
unless they go through a
Oh.
APA, PsyD, or PhD program.
Hmm.
So there's a lot of great clinicians that have master's and doctorate degrees in performance psychology, in kinesiology, that work with major league and NFL teams just on mental skills, building comprehensive goals, developing healthy internal dialogue, focusing on team cohesion, addressing performance anxiety or fear of failure. They may even do some of the work about transitioning out of sport, where then the line changes where an athlete may be struggling with their performance, but they're also having bouts of depression throughout the month. And that's where a mental skills provider or a performance coach will refer an athlete to a licensed professional counselor like myself, who has a specialty in performance. So that transition will be very much kind of a warm handoff for that athlete, knowing that there's also someone that understands an athlete's day-to-day life, which is important.
So in your case, it will be no need to have the two professionals. In your case, it will go to one. In the case of us professionals who are not sports psychologists, it will be a team working with a person. This is how I understand.
Yeah, the professionals that have a certified mental performance consultant credential out of the ASP, which is a sports psychology organization, a credential that has been developed, and there's clinical hours and training that are very similar to what you would look for as a license. This would be a certification. Individuals that hold that credential work with athletes individually or in a team setting, and those individuals can play prominent roles in the Olympic Games and at the professional level.
Well, speaking about doing these referrals and everything, I want to pause because for me it's my time to talk about GReminders. I have been using GReminders and it really organized my professional life and my clients with reminders, with being on time, on a schedule, with everything. So I want to ask you about that. This is an off the book question. Do you use GReminders?
Dr. Roman, I appreciate you asking because I'm a GReminders user too in my private practice for a number of years, and it has been so helpful for me. But the feedback that I've gotten from my patients and clients has been phenomenal. It's made a lot of patients' lives easier to be able to see my schedule in advance and schedule in-person or telehealth visits or initial consultations without that back and forth via email. So it not only is beneficial for me as a provider, but as for my clients and patients, it has certainly been an asset to their patient care.
Yesterday I went to the dentist and he called me to confirm the appointment. And it was my first time with that dentist office. And I say, no, I don't want to be called. I want to have a text and tell you by text and be able to cancel by text. I want you to have GReminders. I kind of called them, but yes, I kind of called them because like we live in a new era. We need to move on. Yeah. So yeah.
GReminder saves everybody time, whether it's a parent or a working professional that can't pick up the phone and make a return phone call. They can just click on a button, look at the text message and confirm the appointment in less than 30 seconds.
Well, GReminders will be very happy that we were generous with talking and talking. Let's talk about sports psychology.
Sure.
What is it? How psychology influence the sport success?
That's a great question. We're learning more and more about that with comprehensive research, is that we will perform at our best when we feel our best off the field. There had been, um, not a lot of research or not a lot of understanding about well-being and the connection with elite performers. And the more we see is that if we are less stressed in our personal life, if we are dedicating more time to personal care, self care, and have healthy relationships with spouses and significant others and friendships. We see athletes perform more consistently. We see athletes play more at a higher level more frequently, and athletes will enjoy coming to sport more. When we see personal issues start to come into an athlete's life, it becomes a natural distraction. Think about anybody working in any type of position. If you have personal issues that you're dealing with or struggling with, whether they be interpersonal or just family-related issues, they can, just naturally come into our work life and reduce productivity and performance. It's a distraction at times. And there's always been this idea, right, Dr. Roman, that athletes can just kind of put on their blinders and block everything out. We see it in the movies portrayed, especially years ago, athletes using a word to block things out so easily. Athletes can't do an extraordinary job with mental skills coaches helping them create that elite mindset. But there's only our mind only has a certain threshold when we're dealing with distress and complex issues, and they will affect one's performance. So, psychology and wellness certainly influences outcomes and performance consistency.
Yeah. Um, you make a very good point. It's not like we want to isolate the mind of the person. We want to take a holistic approach, so to speak.
Yeah, it's so well said, and that's the shift that we're seeing at all levels. Is that recognizing that helping an athlete holistically is the best way to support an athlete as they are developing into a little leaguer, a high school player, a collegiate player, and even at the professional ranks, is that holistic support for an athlete. So that means athletic training. That means maybe strength and conditioning, and if there's physical therapy, and now sports psychology and mental health services. And then when we look at the collegiate level, we talk about academic support as well. Having athletes be able to access services that is holistic will yield larger outcomes. One of the things that that has happened more recently is that mental health services are mandated through the NCAA, that athletes need to have direct access to it in the Big Five conferences. And I think that is going to become standard. It is going to become standard as we move forward. And we're going to see athletes at the high school level have access to providers immediately, and not just athletic trainers who have been historically overwhelmed with athletes disclosing mental health related issues because they had nowhere to go. It was a missing link in developing athletes. The United States Olympics have set a precedent by developing a whole mental health department. They have their sports psychology and sport performance department, but they have their mental health department now too. And they work closely together, identifying athletes that may be struggling with a performance issue that then may start to experience other what we call subclinical symptoms that are not related to the sport, and they'll be easily be able to access the services that they need at that moment. And for a long time, that didn't exist, and they exacerbated a lot of things for student athletes. And now with COVID, athletes coming back, I saw a statistic that said athletes were 200 more times worried about mental health than pre-COVID, which is astounding. And coming back onto campus, a lot of athletes were on campus last year when COVID was still very much impacting our society. Everybody was working remote, and athletes were traveling and playing in competitions, and a lot of athletes were getting COVID-19 because of their just exposure to other athletes and playing day to day. And I think it certainly put a toll on one's mental health over time, and with the added pressure of going to school, especially for those the Division 1, 2, and 3 athletes, and having 40 hours of practice and travel and all the social components, we've seen it become something that has impacted a large percentage of student athletes. And more recently, we've seen a number of student athletes complete suicide at Division 1 level. We've seen at least 4, I believe now. More recently, we've seen there's been reports there was a 5th. And I think those investigations continue to take place, but those families are grieving, and there's a lot of questions asked as why is there so many athletes struggling right now and choosing to end their life at such a young age, and is that because athletics is just so overwhelming? And I certainly think there's something we need to look at more deeply and better support our athletes as they move through their collegiate career and into their professional careers.
It probably is the misconception of if you are strong in your body and you make wise decisions about how you move around, that therefore you have that competency in your mind. Yeah, probably.
And that's the stigma of what athletes have endured, especially in football, that you see men that are very strong and elite athletes, and we just assume that they're not going to be fazed by mental health related issues. This is how it had been perceived historically. And what we know that NFL players that are coming out of the league after retirement are experiencing high levels of mental health related symptoms and issues related to head trauma, related to financial issues that causes distress or substance. So the NFL has launched their Hall of Fame actually has launched an initiative that it's called the Hall of Fame Behavioral Health. So anybody that comes out of the NFL can have access to a provider network that has been vetted, and that they have a direct hotline 24/7. So certainly preventative thinking about how not only athletes that are currently in play, but athletes that have retired or out of sport, which is another whole element that is difficult when we talk about identity outside of sport, that you do something for so long and it's a big part of your life, and then one day it ends. And sometimes it ends because it's not your choice, because there was an injury. And there's a lot of coping about identity and meaning that has to be done. And athletes that that have experienced a career-ending injury would benefit from working with mental health provider on those maybe those feelings and emotions, but certainly the identity outside of sport.
Yeah. As you are talking, it comes to my mind my experiences with. I work with a team of models comparing for the Miss Jalisco in Mexico years ago, and it's the whole identity is who they work all day around that. Yeah, and if like you say, from one day to another, you cannot be that person. It really brings a lot. And also, if you need to be that person, it brings a lot of social challenges too. Yeah. What are an athlete that has anxiety or depression, what they can do as first step?
It's a great question, and there's probably two ways for me to answer it. So a good way to determine if anxiety is just related to sport or if it's generalized. If it's generalized, you're going to want to go to a licensed professional counselor, licensed clinical social worker, a psychologist that has training in cognitive behavioral therapy, solution-focused therapy, and other interventions that will help address generalized anxiety. When we look at situational anxiety, where it's only in a specific area of life, such as sport, for example, that's where a parent or an athlete can schedule an appointment with a performance consultant or mental performance provider if you are experiencing performance anxiety. And that is a very common thing all across the world. And I'll give you an example. If someone is looking at ways to reduce performance anxiety, which is something that we all experience, if you ever publicly speak, maybe there's test anxiety, which is a performance-based anxiety. How do we reduce that? And an intervention that is so helpful, and it's the best way to reduce anxiety, because when we have anxiety, typically the first symptom that we have is an increased heart rate, then causes the secondary symptoms such as shortness of breath or a dry mouth or racing thoughts. So if you start to feel anxious, and everyone may have a different interpretation of what anxiety is, diaphragmatic breathing is a tool that you can use anywhere at any time. It's just one of those things that you want to make sure that you practice before you go into that environment, so you know how to use that skill. So diaphragmatic breathing, using guided, a visual. There's a lot of apps. But if you just type in breathe bubble on YouTube, you'll find that a bubble that will guide you to show you how long that you should breathe in and breathe out. And those holds in between will help slow your heart rate down and minimize any performance anxiety that you may be having.
Again, I'm going to back to Ted Lasso because I just love him. Ted Lasso is a coach, and he himself was struggling with immigration issues, with loneliness, with whatever was in the new country. Yeah. He took time to recognize that he needed help. I believe coaches, as parents, and everybody needs help. Do you find that coaches have a hard time recognizing they need help?
I say yes. Historically, coaches would have a hard time seeking support from a professional that is performance-based. More recently, so I work at Temple University, and a part of our model of care and services, because we work in a continuum, mental health, wellness, and performance, and athletes will fall on that continuum at any point during their collegiate career. But one of the things that we have done is we schedule programming once a month for our coaches that's on topics that are very relevant to today's athletes. And we have educated coaches on suicidality, on anxiety, depression, and ways to support them. That has opened up communication and rapport with our coaches, which at a Division I level, that are very receptive to having conversations with our staff about ways they can better support their team. So any coach at any level would benefit from a conversation with a performance-based professional, or if you have questions about how to support an athlete who may be struggling with mental health, those are all things that you can educate yourself on to be a better coach, better support for your team.
Yeah. And my last question, because I know you are also too busy. My last question is about, as parents, what we do when our children have aspirations and what we can do for them.
It's such a great question. You have to be mindful that a child that has aspirations of playing at a higher level, whether it be high school, varsity baseball, basketball, football, gymnastics, or at the collegiate level, like we've talked about, there's 3 different levels, or even higher. It all starts with support, unconditional support as a parent, and not so outcome based. Making sure that your child is having fun in their sport, and they're getting enjoyment and fulfillment out of going to practices and then competing in games. And some rules that I have told parents to do is, especially in that car ride home, which a lot of athletes typically say is the worst for them if they underperform, and the parent wants to break that down and understand what happened, is I wouldn't focus on outcomes in the car or debriefing in the car. Let your child guide you in talking about what they want to talk about on the ride home. Athletes that have balance in their schedule so that they have variety. I had mentioned early on, athletes that engage in different sports have better outcomes in their athletic career. That's because different sports yield different opportunities. Maybe you are a individual athlete because you play tennis or golf, but if you play a team sport, you may learn dynamics and components of sport that helps you be a better performer later on. So I encourage parents to encourage their children to engage in other performance sports, because you're going to get a lot out of it that's going to help you in your primary sport. The other thing is that as a parent that has a student athlete, making sure that they understand that student is first. Student athlete, there's a reason why student leads, is that emphasizing other parts, that holistic part of your child, is that academics continue to be important, because, as we mentioned, you can't play sports forever, at least not at the professional ranks, and that you have to have other parts of your life that bring you joy, whether that's having a part-time job as a child in the summer, or there's a creative side. Maybe there's they like to play instruments, or they're into art. I really think that as a parent, if you can help your athlete create balance early on, they're going to do a lot better as they move into a higher ranks, whether it be at the collegiate or professional level.
Yeah, you really provide us with a great answer, because sometimes we want the child to succeed, and it's easy for them to focus only in the sport. Yeah, that's a good point. Is anything else that you would like to say for us to finish this conversation?
If you have a child that is an athlete and you see they're struggling, make sure you ask every day your child, how are you? How are you feeling? Open-ended questions. And if they open up, talk to them about how seeing somebody, a mental health provider, could be really beneficial. There doesn't have to be something wrong to go work with a mental health provider, or just have a wellness check, just like you would go for a physical with your primary care physician. It's been a stressful and complex 2.5 years with COVID-19, and everybody could benefit from checking in with a provider input in prioritizing our wellness and mental health.
Thank you, Edward, for your time, for your generosity with your answers, and just introducing us to this world of sports psychology here to the Amigos in Harmony. I'm sure they will have questions. I'm sure they want to follow up with you and what you know. Where they can find you?
You are welcome to follow me on Twitter, Edward P. Dara. I also have a Facebook page, Dara Counseling. And I also have a LinkedIn, so you're welcome to follow me on LinkedIn. But I post a lot of educational content on my social media platforms, especially Twitter and Facebook, for parents that have children that are athletes. And it could be just, if it helps one person, it's so worth doing it. But you're welcome to follow. My website is daracounseling.com, and I also have a website called athletewellness.org. You're welcome to go and visit my site. You can contact me directly through my sites, and I'm happy to provide you resource and support.
And if you are listening and you are a psychologist or mental health professional, just go and visit Dara, Edward Dara also, because you may benefit from his work and his team. He also has a Facebook for that, a Facebook page for us mental health professionals. Yeah. All the links are going to be in the show notes. If you are in this podcast in the show notes, or just open it, just slide the screen. And if you are in YouTube, it's going to be below this video. Yeah, so you will have all the information you need. If you are driving, please do not take notes. You have it there. Okay. Edward, thank you for being here, and bye for now.
Thank you, Dr. Roman. Bye-bye.
Okay, and we say thank you now to Edward Dara for all this wonderful information. And you may wonder, who is him and why is he talking? What authority he has to talk? I'm going to read the bio, and I'm going to read because I don't want to miss anything. So bear with me. Edward Dara is a licensed professional counselor in Delaware, Pennsylvania, and in Florida too. Edward holds board certifications in counseling, in school counseling, and telemental health. Edward founded that Edward Dara Counseling and Athlete Wellness Consulting back in 2015. He provides mental health and sport performance services in the Philadelphia area and probably in Florida too. Since 2018, Edward has been a full-time staff member in the Temple University Athletics. Isn't that fun? Well, I hope he has fun. Serving as the Director of Student Athlete Mental Health. Edward is also listed on the USOPC Mental Health Registry. Edward co-authored the Metacognitive Student in April 2021. Additionally, he co-founded the startup called Flourished Healthcare in 2020. As you can see, he is extremely busy. He likes to use social media to inform especially parents about how to help their athletes at home. So you can follow him in Twitter, in LinkedIn, in Facebook, and all the links are in the notes. Thank you. Thank you for being all the way here with us in this conversation. I hope you have a wonderful day. Bye for now.